Hi, this is Dr. Nemechek. I want to talk to you about how we regulate blood pressure to our head and how brain injuries can cause us to have problems with that. And this little graphic here is kind of nice. Here's this patient. He's got it's nice. You can see his heart and all his blood vessels. And the key thing here is having to push blood upwards to the brain and upwards against gravity. That's one of the big challenges we have when we're upright. And that's one of the things that gets damaged when you have a concussion or some other form of brain injury. Now, when you have these injuries, many times you're having injury to the autonomic nervous system. And that's what this graphic here shows. And it's composed of the sympathetic and parasympathetic branches. And it's the sympathetic branch in particular that helps regulate blood pressure to your head. And when this gets damaged, people will have symptoms like headaches. They get chronic neck tightness, especially when they're sitting still. They'll crave salt and sugar. They'll start becoming addicted to nicotine because nicotine will bypass the blood pressure. They can't think, they can't focus right. They get diagnosed with attention deficit disorder or ADHD. They find themselves really fidgety. They'll be tapping their feet all the time and so forth. All of this stuff is a reflection of the inability to regulate the proper flow and pressure of blood into the brain because the brain only has 1 second of reserve oxygen to the brain. So normally what happens is now when you're laying flat, there's no gravity to compete against. You're able to get oxygen throughout the body at this nice pressure. But when you stand upright, the nervous system is trying to have to push upwards against gravity in order to have that same normal blood pressure reading. All right. Now, when you get an injury to the autonomic nervous system from a concussion or some other non-traumatic form of injury, there you are, you're able to get normal pressure of the brain when flat. Okay, that's what we were just saying. But now when you're standing up against gravity and you feel a little lightheaded today, for instance, your pressure's lower in the brain. It's not the same. That's because the nervous system is damaged. You can't push up there. So, now this is why nicotine from tobacco and then ADD meds will drive blood pressure to your head and they make you feel better and they help you wake up. And it's why the brain literally starts commanding you to chew tobacco, for instance, because you got to get pressure to your head. I should also add that salty foods like sunflower seeds and sweet foods like Gatorade or bubble gum will also boost blood pressure to your head. In the body, we have these nicotine or nicotinic receptors, and they are part of the sympathetic nervous system. When triggered by the brain, they cause the heart to beat a little more vigorously. They cause your blood vessels to clamp down, and those are the main things that are going to be regulating blood pressure to your head. All right. When you get a concussion, that signal that would come down to there gets broken. You won't get a signal there. Okay. So this is why when you chew tobacco or smoke tobacco, you get nicotine in the bloodstream. The nicotine will bypass the damage, trigger these receptors here, and cause your heart to beat more and your blood vessels to clamp down so you get better pressure to the head. All right. The ADD drugs like Adderall, Concerta, Vyvanse, Ritalin, all of those drugs also bypass the damage in your bloodstream by triggering these receptors and driving blood pressure to your head. And people are like, well, gosh, that sounds strange. Why does that happen? And well, a little bit of proof that that's what's going on is in a very simple scenario. Now, so as I said, and you lay flat, you don't have gravity, it's easy to get pressure to your head even if you have a concussion. Here, this gentleman has a concussion here. You can see he's feeling a little loopy and he's got the lower blood pressure. Now, if we take that same person and we give them ADD meds, they're going to trigger those receptors. Or if you give them nicotine, they're going to trigger those receptors and they will boost that pressure back up to the patient's head and the blood pressure comes back up to normal. All right. So, nicotine bypasses the damage of brain injury. ADD and ADHD are symptoms of the inability to regulate blood pressure to the head because of damage to the nervous system from a concussion, for instance. That is what they are. And one of the proof is you'll take a cigarette smoker. He's smoking a pack a day, 20 cigarettes a day to drive pressure to his head. He's got to have one every 30, 60 minutes. Otherwise, he's agitated or irritable. But when he goes home at night and lays down flat, he can now sleep 8 hours without a cigarette. It's not about nicotine. It's not about nicotine addiction per se, I should say. It's about getting oxygen to the brain. That's really what's going on here. Now, with the Autonomic Advantage program, we've got techniques now in the average person within about 3 to 4 months, they're off their ADD meds or they're able to easily quit nicotine, because what we do is we are able to change your repair mechanism in your body, and your body is able to repair that damage. All right, so the Autonomic Advantage can fix your brain and help you get off nicotine or your ADD meds, or just even avoid ADD meds and make those symptoms go away. We hope you find this useful. This is Dr. Nemechek. Thank you very much.